So for my current event, I chose a Washington Post article that posted like a month ago, January 17th, 2023. The title of the article is Maryland Lawmakers Seek to Remake the State's Health Delivery System. So there are a lot of changes happening in Maryland. There's a newly appointed Secretary of Health. Her name is Laura Herrera Scott. So a little bit about Laura Herrera Scott is she was a major in the Medical Corps of the Army Reserve. She was the chief medical officer in Baltimore City Department of Health. She was Deputy Secretary of Health from 2011 to 2015, and she has a master's degree in public health from Johns Hopkins Bloomsburg School of Public Health. And when she was in New York, she focused on disparities in health access. So she's bringing that with her as she starts to make some changes in the state of Maryland. So the two bills they're planning to introduce in Maryland have to do with substance abuse and mental health. The bills are going to help alleviate the strain that the emergency departments have been having. According to the Center of Medicare and Medicaid, Maryland had one of the worst wait times in the emergency departments during the first year of the COVID-19 pandemic. So the goal is they are going to treat people suffering from mental health and substance abuse preemptively, like you would any other illness. They are going to have commissions, proposals, surveys, and federally qualified clinics to assist with mental health illness and substance abuse. The legislation is also going to look at social determinants of health and structural inequities such as inadequate housing, racism, lack of transportation, and classism. The new bill is going to help have shorter wait times, and it's also going to provide more services for people, so it's going to have a positive impact on all the people of Maryland. The price tag on this bill is $2.5 to $3 billion. Some people say it's a steep price tag. According to Jocelyn A. Pena, the chair of House Health and Government Operations and Committee, she states that you either pay now or later, and it's actually worth it to pay now. And she says it's actually more expensive to pay later. So not just monetarily, she talks about how it affects people emotionally, the distress, the anguish that the families and the friends go through, the people who suffer with mental health and substance abuse. And also, they mentioned in the article past success. So, Lori Doyle, who's the director of public policy for Community Behavioral Health Association of Maryland, she references success in the state of New York, where behavioral health emergency department costs dropped by 26%. Oklahoma, psychiatric hospitals had a 93% decrease in inpatient hospitalization among adult clients. And after 3 years, Missouri emergency departments had a reduction of 36% in visits. She states that you would not manage diabetes with emergency room visits, so why should mental health be treated any differently? Which is something that I agree with. I think it's a great initiative, and I'm looking forward to seeing how it impacts Maryland and if it's successful or not. I think it would be. And my three questions are: do you believe 2.5 to 3 billion is too high of a price tag? Would you want a bill like this to pass in your home state? Do you believe it is important to have individuals like Laura Herrera Scott, pictured on the left, with the public health background and positions such as Health Secretary to make positive impact on citizens' lives?